So if you have a sluggish thyroid, you're going to be more chilly because your body is trying to conserve energy, and it's trying to, it can't heat the body as much because it takes energy to heat the body. So if your body thinks that you're starving, it's going to shut off the body temperature a little bit. It's going to slow down your metabolism. So a lot of it comes from the thyroid.
The thyroid. So in my family, since we were little, we were always cold. And we're thinking, oh, it's just a body temperature. So that's not correct. So we have a sluggish thyroid. That could that be it? Because since we were little, my other sister, her and I were always cold. So I'm trying to kind of re-educate myself just to improve my wellness.
Unfortunately, the only way that you can figure out the answer to this question is to get blood work. I mean, your blood work and your hormones don't lie. So if you're doing things that are harming your hormones, like your thyroid, then it's going to start affecting you health-wise. So the only way that you can find out what's going on is to get these tests that I asked you guys to get.
So we have to ask for a thyroid test. Is that what you're saying? Or is it all the panel, a different panel?
It's a different panel because the ones that our healthcare system uses give you half the story. Your thyroid can produce a bunch of T4. That's what the TSH. So your doctors go off of TSH. It's the thyroid hormone. They go off that, and some do the T4 also. But what that doesn't, it only gives you half the picture. Yeah, your thyroid can be producing a lot of T4 or an average amount of T4, but if that T4 is not converting into T3, then it's converting into reverse T3, which they don't test. So you don't know what's going on with that T4. So they'll say, yeah, you're fine, or they'll say, no, you're not fine, but you don't know if it's converting into T3 or reverse T3 because they don't test for it. And then when I ask for these tests, they don't understand what these tests are for because that's not how they're trained. I mean, the only thing they do is what they're trained in school. And school, the curricula of medical schools is regulated by Big Pharma because they're the ones who are sponsoring a lot of these schools, Harvard and Yale being the worst of all these people. There's a lot of kickbacks. And in exchange for getting hundreds of thousands of dollars for a talk that a Harvard professor will give, in exchange for that, the pharmaceutical industry can help create the curricula of the medical school. And all it is geared towards medicine. That's all they care about because that's how they make money. There's no money in prevention. That's why I'll never be a billionaire because there's no money in prevention. They always wait until you get sick and say, I got the pill. And then they keep you on those pills for the rest of your life where you have to keep paying. So that's how they make their money.
Thank you for educating us.
You're welcome.
And I also just want to add one more thing. Since I started the program, I feel that I'm able to move more, even jump more. Yeah. Yeah. And I have more durability or stability, whatever you want to call it. But I'm surprised at myself. I go, oh, I'm jumping. Oh, I'm moving faster. Yeah. And things don't hurt as bad. So thank you so much.
You're very welcome. I can't wait for the day that you don't have any pain.
Oh, I'm getting there slowly, but I was able to move around. But thank you so much. Thank you, Jovi. Jovi, are you there?
Yeah.
Okay, bye.